Standing, sitting, anything. Moving, it all hurts.
Holding a pen was ultra difficult. Driving, holding the steering wheel.
I have trouble buttoning my jeans.
I have a really hard time cutting food.
I found it very difficult even to lift a toothbrush to my mouth.
Or holding a coffee cup is a challenge. It kind of changes the way you look at life.
We take so much for granted. We take the ability to brush our hair, brush our teeth, use a fork, button our clothes. Those are things that we do day in and day out. But for people with rheumatic diseases, it's bigger than that. It's hard to do these simple tasks.
Rheumatology encompasses a wide variety of diseases. The main common denominator is that these are inflammatory diseases. Many of these diseases cause arthritis, which is inflammation of the joints, but they can also affect every organ of the body.
The disease is so unpredictable, you never know how you're going to feel when you wake up in the morning.
Rheumatic disease knows no bounds of age nor sex. It affects everyone. The bulk of my practice is probably in the age of 40 to 70, but we see people as early as 18, and of course rheumatic diseases can start as early as birth.
One day I can feel like I want to run a marathon, and the next day it's a struggle to even get out of bed.
Rheumatic diseases are the #1 cause of disability. We want to keep these folks functional. We want to keep them in the workforce. We want the quality of their life and their ability to just take care of themselves to be maintained.
One of the things you learn when you have RA is every day you sort of calibrate yourself. Am I having a good day or a not so good day or a really bad day? And there are some days you simply can't do even some of the most mundane tasks.
I think that's the main thing, trying to find a rheumatologist as soon as possible. And I was lucky that my internist knew that something was wrong and sent me to the rheumatologist.
It seems very clear that you have that limited window to start meaningful therapy, and you can truly bend the shape of the curve of outcome for that patient.
I think rheumatologists are the Sherlock Holmes of medicine. They're the ones who get the patients that no one else can figure out.
Rheumatology is a journey, it's not a destination, it's a continuous relationship with the patient and the doctor.
To have a doctor that knows what he's doing, that is proactive in drawing out information from the patient, not just empirical data, but how you feel, and more of a personal relationship that he develops, I think has been paramount in my well-being.
I'm really inspired by the patients that I care for. I see what kind of difficulties they have and what they put up with every day, and I am only spurred on to do more and more for them to try and make their lives easier.
They want to have the ability to continue to provide the latest and greatest tools for their patients, and obviously their patients are concerned that they have access to those medicines as well.
Many things can be done that were not even thought of 15 years ago. And we are trained to look at the patient from all perspectives, their comorbidities, their other medications, and try to devise the best treatment options for them at a given point in time.
Without doctors like Dr. Wesselman, I would not be able to do what I do now. She's a vitally important part of just my very existence and living.
My rheumatologist makes all the difference in the world.
There are not enough rheumatologists. We need more. We need the funding. We need more research. There is more that we have to do to be able to help these patients.
I think we can look to the future with hope. I think that the science that's been developed by the rheumatologists who are in research is phenomenal.
I think this is a priority, and if we don't put money towards research and give money to medical schools so that they train rheumatologists, then people won't have access to a doctor, and we won't be able to get to the root causes of the problem.
Everyone is affected by this in some way, shape, or form, which says to me that we not only need to do something about it, but that we can. This should not be pushed to the back burner. We can affect literally millions of Americans' lives and give hope to people around the world.